Have you ever had your heart imaged? And wondered why or what was going on? Welcome to Cardiac Imaging. I'll be explaining the types of cardiac imaging and its process, why are they important, and the pros and cons. So what exactly is cardiac imaging? Cardiac imaging is a subspecialty of diagnostic radiology. It is used to diagnose heart diseases, leaky heart valves and any potential defects in the size and shape of the heart. Why is it important? Cardiac imaging enables a detailed evaluation of heart dimensions which allow the diagnosis of heart issues. Without the imaging tools we have access to, the diagnosis of coronary artery disease and heart tumors would be almost impossible. A cardiac radiologist will use imaging techniques such as a cardiac MRI, coronary CT angiography and echocardiograms to help diagnose or observe a patient's heart problem. CCTA uses CT scanning to take images of the coronary arteries of the heart, which is seen when used in conjunction with angiography. Before a CCTA, take medication to slow down heart rate to obtain a clearer image. Minutes before the CT scan, the back of mouth is sprayed with nitroglycerin to dilate coronary arteries. The patient lies on the bed that slides in and out of CT scanner. It is important not to move as it affects the quality of image. A test dose of contrast is given to determine exact time to begin scan or automatically done by machine before scan. The patient is given rapid IV injections of iodine contrast agent. Once the iodine contrast reaches the heart, the scan starts and the patient holds their breath for 10 to 12 seconds each time scan is taken. When the heart moves the least, the CT scanner takes a series of images of the coronary arteries, diastole, free of motion, so they appear sharp. An image is taken in multiple planes which allows the 3D dataset to portray the coronaries in a specific plane. Conducting a CCTA is incredibly important because it helps observe if there is an abnormal anatomy of the coronary arteries, monitor or diagnose the chance of low or intermediate risk for coronary artery disease, and follow up on coronary artery bypass grafts to ensure post-surgery is successful. Cardiac MRI scans require the use of a high-strength magnet and radio waves to scan the heart and produce an image of the heart. There is no preparation unless you're getting a cardiac stress perfusion MRI, where you avoid caffeine 24-48 hours before, as caffeine interferes with the performance of adenosine used to simulate stress. Electrical leads are attached to patient's chest to monitor heartbeat. A special set of detectors encased in plastic is rested on the patient's chest, which works with a main magnet to receive the radio wave signals to produce the image. The patient is positioned comfortably on the bed and moved into the MRI machine, where gadolinium is injected if required to highlight the blood vessels. For cardiac stress perfusion MRI, contrast medium and adenosine are both used. Conducting a CMR is important because it helps radiologists evaluate signs or symptoms that may suggest cardiomyopathy, congenital heart disease and heart failure. To evaluate the effects of a patient with coronary artery disease, such as limited blood flow and scarring to the heart muscle, and to observe any reduced blood flow, which would help determine whether heart artery blockages are the cause of your chest pain. Echocardiograms use sound waves to produce images of the heart. There are a few types of echocardiogram: transthoracic, transesophageal, and stress. For a transthoracic, electrodes are placed on the chest wall, which monitors the heart rate and rhythm. Gel is placed on the chest to help sound waves pass to the skin. Then, the transducer or probe is firmly placed on the chest wall, which sends sound waves towards the heart. Waves will then bounce off the structures of the heart and return to the transducer, where they are processed on a computer. The patient may be asked to roll onto their left side and take deep breaths in order to obtain a better visual of the heart. And once the patient is sedated, the cardiologist will proceed to put a tube with the transducer on the tip through the mouth and position it in the esophagus at a level near the heart. For a transesophageal echo, the throat is numbed using a spray. Medicine may be given via cannula in the arm to help patient relax. A flexible tube with a transducer is passed down the throat and into the esophagus. For a stress echo, images are taken before and after exercise while electrodes are attached. However, if the patient is unable to exercise, injection of a medication will be given to pump the heart harder. Conducting an echocardiogram is important as it helps assess if you have problems with the valves or heart chambers, observe the heart's pumping strength and any heart defects, and help identify any tumor or infectious growth around valves. There are many advantages and disadvantages for the process of cardiac imaging. Some advantages include: both CMR and CCTA have excellent resolution of 1 mm and 0.6 mm, respectively. All techniques have a relatively simple protocol. All techniques provide a comprehensive and multidimensional exam of function, perfusion, viability and thrombus. Both CCTA and echocardiography are cost-effective for a wide range of medical problems. All techniques provide very detailed images of many tissues. CCTA has the ability to view bones, soft tissue and blood vessels at the same time. Both CMR and echocardiograms have no ionizing radiation. However, CMR compared to the other techniques has a relatively high cost. Comparatively, CMR has long study times. Many obsessed patients cannot fit into many scanners used for cardiac imaging makers. Patients undertaking CCTA have a slight chance of cancer due to excessive exposure to radiation. CMR requires patients to remain still and hold their breath since respiratory artifacts can degrade images. Contraindicators within CMR currently include pacemakers, defibrillators and many other devices. Claustrophobia prevents some subjects from completing the imaging process. Therefore, regardless of the disadvantages that cardiac imaging poses, cardiac imaging is incredibly important. This is because it is necessary for the diagnosis, prevention and treatment of many heart issues. This is only possible with a variety of cardiac imaging that reveal different information about the heart which will ultimately help the quality of life.